Welcome, everybody. We'll go ahead and get started. I wanted to take a moment to introduce our speaker today, Eric Bruns. So before we did so, I wanted to also mention a few things about our course series. So I'm Sue Kearns. I'm an assistant professor in the Division of Public Behavioral Health and Justice Policy, which is also where Eric comes to us from today. But we have a course series that we've been putting on now. I think this is our second and a half year, so kind of going through monthly seminars to try to give a range of different information to people out in the community, the university community, as well as the community at large, about evidence-based practices and how we can be informed across a range of different aspects. So you'll see that in the course series that we have that goes over the next 8 months, that there's a range of different topics that cover a lot of what you hear about in the literature and hear in the popular press as well about evidence-based practices. So our website is here. All slides and information about the course series can be found on our website. And we just wanted to let you know a little bit about the upcoming lectures that are the next lecture in November. I'm actually going to be doing on matching evidence-based interventions with youth problems that the youth and children and families have. So kind of thinking about the scope of different issues and challenges that families present with. How do you make informed decisions about the links to evidence-based practices? Shannon Dorsey will be here in December talking about anxiety and trauma-related symptoms and best practices for that. And then we have Jamila Reed, who does work with the Incredible Years, and really looking forward to her talk in January around oppositional defiant and conduct disorders. We have Kevin King coming in February to talk about motivational approaches. Michael McDonald is going to talk about serious mental illness in adolescents. And Janine Jones in May will be talking about multicultural issues related to evidence-based practices. So we're really excited about the agenda that we have set up for this coming course series, and hope that you'll join us for more than just Eric's lecture, although if this is the only one you come to, I'm sure it'll be worth it as well. So if you want to learn more, here are our websites again. And without further ado, I think what I'd like to do now is introduce Eric Bruns. He's an associate professor in the Department of Psychiatry and Behavioral Sciences. He's also the director of the National Wraparound Initiative, director of the Wraparound Evaluation and Research Team, co-director of the Washington Children's Mental Health Evidence-Based Practices Institute, and chair of the Board of Advisors of the Research and Training Center on Children's Mental Health at University of South Florida. I don't know how you have time to do anything else. But in his meantime, what he does is he examines the impacts of community-based services and supports for children with complex needs. He's been a principal investigator for several NIMH-funded studies and has authored over 50 refereed journal articles and book chapters. And in addition to all of this, if he wasn't excited enough by all those activities, he also is the editor of the Report on Emotional and Behavioral Disorders in Youth and an associate editor of the Journal of Child and Family Studies. So I'd like to welcome my colleague, Eric Bruns, to talk to us about Wraparound.
And it's all really just to support my surfing habit, all of those activities, which is what I do in my spare time. So I'm Eric Bruns. It's nice to be here kicking off this series that our division and Sue and Andrew and others who are here today coordinate on evidence-based mental health. And I'm going to talk about something we call the wraparound process today. We're going to go over what it means to call something wraparound. When you hear wraparound, what does that mean to you? What's the evidence base? What does it look like for kids and families? Why are systems increasingly implementing this model? So wraparound is actually not really formally a mental health service. It's an intensive care coordination process for young people with very complex needs and their families, but it definitely has relevance to evidence-based practices and evidence-based treatments in several ways. First off, a whole lot of communities and systems and states have shown that implementing this team-based wraparound process can reduce the system's reliance on out-of-home placements for kids with even the most serious and complex needs that span across mental health, child welfare, juvenile so forth. So there's a lot of evidence that communities and jurisdictions that implement wraparound can redirect funds that are often reserved for out-of-home placements for community-based care. The second way that wraparound has something to do with evidence-based practice is that there, as we'll see at the end here, hopefully we'll have time, to look at some of the research. There's accumulating evidence for the wraparound process and its ability to actually promote improved outcomes for young people. There's an increasing literature base from controlled studies. And then third, and this will be really relevant to Sue's lecture next month, wraparound can be a way to ensure that families are better engaged in the evidence-based treatments that are available in a system, or that a community or a state or a county is investing in, by better engaging families, building their self-efficacy, and creating more holistic and effective integrated treatment plans. So there's a few ways, even though wraparound is really not a formal mental health treatment or service, that it really does interact with the need for us to provide services and supports of evidence for effectiveness to young people. So wraparound is something I've been conducting research on for at least 15 years now. And so here are some folks who've been with us along the way, including my mentor up at the University of Vermont when I went to grad school, John Burchard. Everything I do is in his memory. He passed away in 2004. He and his wife, Sarah, wrote the first monograph about wraparound. It's called, it was about the Alaska Youth Initiative. It was called One Kid at a Time. Really amazing series of stories about the kids who were served by that project. So I came to work with John and Sarah in the early 90s, and the reason I was inspired to kind of dig into this in graduate school was I was working in a group home for kids for a couple of years, and as is often the case when you're immersed in something that you really question whether or not it's working or not, you want to kind of find a better way. And so, this facility was clean, it was safe, relatively safe. It had caring, really dedicated staff. But by the end of my 2 years working there, it really didn't make a whole lot of sense to me. So what was the point of our designing these treatment plans that were primarily about the kid being stable in this facility in the absence of really working with their parents, their families, who would be the individuals that would be supporting them ideally in the community when they left, right? If the ultimate goal is to help them succeed in their homes and communities, why are we investing all this effort in trying to stabilize them and create these plans in these facilities? And the other thing that I noticed was that, I was 22, 23 years old, it was such a good idea to have these young people in this nice, clean facility with cool guys like me who wanted to play basketball, who were there to play basketball with them from 4:30 to 4:45 if they had accumulated enough points on their level system. Why were they running away from the place so often? And why were they running back to the families that had not provided adequate parental supervision to expose them to drug use and other kinds of issues in their homes? So, by the early 90s, the field had really come to the grips with these issues. And there was the idea that no matter how complex the youth or family's needs, if we promote safety along the way, maybe we could take those tens, hundreds, oftentimes hundreds of thousands of dollars that might otherwise be spent on a group home placement or a residential treatment center or detention or psychiatric hospitals, treatment options that really then and still now have very little evidence for effectiveness. Take those dollars, those resources, and invest them in intensive community-based treatments that might actually flexibly apply those dollars to community-based treatments and other supports. Maybe we would find a way to better ensure that those youth would succeed in their homes and communities over the long haul. And there are a few such models. People might have. Do we have a lecture on MST here yet?
Not this year. We did last year.
Yeah, last year. So multi-systemic therapy is another example of an intensive community-based treatment. And wraparound is another. So historically, MST has been, wraparound has been much less well-defined than treatments like MST. In early years, wraparound was really literally defined as doing whatever it takes to keep the youth safe and in their homes. Apply those dollars to a treatment plan that people came together around to develop these integrated plans and literally do whatever it takes. Now, over the years, one of the most important tasks of folks up here on our research teams has been to better define the model. All right, so that it can be faithfully implemented and its fidelity measured and research conducted on it. So to learn more about the effort to try and define better what wraparound is, create fidelity measures, create training and coaching kinds of curricula, you can go to our website, the National Wraparound Initiative, which is there, nwi.pbx.edu. It's hosted at Portland State University, where my colleague Janet Walker is. So let's just go ahead and dive into this. What is wraparound? What is the wraparound process? This is what we're really focusing on today. So the wraparound process is a family-driven, this is how you sum up something incredibly complex and that has multiple levels of effort necessary in one slide, right? So at a family level, it's a family-driven, team-based process for planning and implementing services and supports. Through the process, teams create plans that are geared towards meeting the unique and holistic needs of youth with really complex needs, multiple system involvement, and their caregivers and families. And the idea is that this team is really relevant to the youth and the family, and it meets regularly to implement and monitor the plan to ensure its success. And the team members include individuals relevant to the success of the identified youth, including parents, caregivers, other family members, community members, mental health professionals, so the people who are paid to care, who are most relevant, as well as those who are going to be there for the youth over the long haul. Right? So that's the way to really simply define it in one slide. I'll try and get into a lot of details about what it actually looks like in practice in a second. Now, just before we do that, how many folks have heard of wraparound or been part of it in some way, shape, or form? Okay? How many folks really feel like you know what it is? Right? So this is kind of the situation in the field out there a little bit. You know, you hear this term used a lot, right? Wraparound sunglasses, wraparound hockey goals. In behavioral health, we often hear about wraparound services, which are potentially, sometimes you'll see this described in treatment plans. And these are different types of services that might be useful for an individual seeking help or a family or a young person, but they're not traditionally available or reimbursable. So like transportation, childcare, recreation. So that's one way to hear the term is talking about making sure that wraparound services are available to the family or for a youth or an adult for that matter. You also hear wraparound philosophy or wraparound approach. Like, our organization really takes a wraparound approach with everything it does. We have a wraparound approach in our residential facility. We have a wraparound approach in the way we provide behavioral rehabilitation services. And what that means typically, although there's not pure consensus on this, is applying the principles of wraparound to whatever service or context or the work of any type of helper. So, in other words, services should be family and youth driven, individualized to their specific needs, culturally competent, and emphasize maintenance of the youth in community settings wherever possible. So that's kind of the basic principles of wraparound, and sometimes people talk about the wraparound philosophy. These are all a little bit different than the wraparound process, which is what we have been trying to define, what we do research on, and that I'll go into now. So why is it that we invest in this wraparound process, this team-based process? A couple reasons that will be better kind of told through a story of a family. So in the kind of research way of looking at this, we know that working with youth with complex needs and multiple system involvement is challenging. We've seen that outcomes are typically poor for these young people. Child and family needs are very complex. They have multiple and overlapping problem areas, diagnoses. Families have unmet basic needs. That makes it very difficult to engage them in services. There's lots of challenges to overcoming the barriers to engagement. And this leads to a lot of treatment dropout and missed opportunity. At a system level, we know that our systems are in silos, right? Special education, mental health, primary health, juvenile justice, child welfare, they all have their own individual mandates, philosophies, eligibility criteria. But the fact is that there is this subset of youth who wind up getting involved in multiple of those systems. And the systems don't really work well together on behalf of those kids with those complex needs and might get touched by multiple of those systems unless there's some way to bring them together.